Get on some extra light. How's everybody doing? We are going to work on some examples for the CPC exam or CCS, CCA, any of those medical coding exam certifications. I am working on 2022 guideline notes. They're going to have each code in the middle of the Word document. Then it's going to state the most obvious stuff that you need to highlight, like detailed, comprehensive, straightforward, low, 3 of 3, and the time. Then on either side, I'm going to have tips, examples of how to code each one, and stuff you might not know, abbreviations, some more coding tips, and then definitely an example for each one that'll go along with it. This will be for the 2022 year. So hopefully that will be helpful. Hello, Kimberly. Hello, Nurse Zing. Hello, Coupon Cutie. All right. Let's see. I've got some information that I thought was kind of neat. And then I found a question that went along with it. So let me see. Now, if I can find the information that I found last night, usually in a stupor, at 4 in the morning working away on this. It was quite fun, but they had a list of items. Here we go. If your patient's in critical care, right, you are billing based off this chart in the CPT book, and you're mainly concerned with looking for the time. 120 minutes is usually average, and then you just look at the chart to see how you bill it. And if we were doing 120 minutes, you would bill it with 1-on-1, the 91, and then the 92. But they also have a list of items here that are included with it. So when they're in the middle of critical care, you're not billing out the individual x-rays, look at that, gastric intubation, ventilation management, pulse oxes. You're not billing your EKGs, those kind of things. So that's kind of interesting. It's all wrapped up in the critical service code. So something to make note of and remember, and don't let them trick you during your CPC exam to see, and then they add like a chest x-ray to the critical care. When they were brought in doing some critical care services on a patient for an emergency basis, they stayed in critical care for 120 minutes. They're going to have you bill whatever the chart says, and then they also throw in a chest x-ray or something like that and make you think that that needs to be added. So let's not do that. Might want to keep note of what is included. And bring up my test question real quick that's going along with that one. How's everybody doing? The eve before Halloween. My kids are so excited to go out trick-or-treating with their friends tomorrow. So based off what I just said, which service is not included? That one says intensive care, but I'm assuming it's sort of the same thing as critical care. Close enough for government work for this question anyway. But what about this one? Cardiac and respiratory monitoring, vital signs, and nutritional adjustments. Which ones are not included with those codes? And the answer is going to be D. None of the answers are correct. This one I got from a AAPC practice exam, one of those 50 question ones, one of their more recent ones. So I kind of liked it. So I wanted to make sure that we knew about that. This evaluation management stuff can always be so confusing, for sure. One of the questions that was on my exam is they wanted to know the order of digestion. So I went through on page 332 of the CPT book and made sure I had the order of digestion labeled in numerical order. I had to draw in some parts because they didn't have them in there. But adding in that kind of information saved me on that question about the ileum, the cecum, and the duodenum, which one was first, second, and third. They had them as A, B, C, or D, but they had them in all mixed up orders. You just had to pick out the right order. So that helped a whole lot during my exam. Let me pull up some more practice questions and we'll work on the process of elimination. And I'll check on and I'll scrunchy this test up so that we can get it all into the frame. We'll switch over to some E&M codes like that critical care. I had to tab my book with a sticky note for those stupid evaluation and management, the physical codes, because they're way back here when I think they should be in the front of the book. They're just hard to find when they're wellness and exams. I just think they should be somewhere closer besides nursing home detail. For the 2022 book, they did keep out all that information. You don't have how many the requirements are needed per CPT code. Again, you also don't have the history or the exam, whether it's detailed or problem focused, what have you. The only thing they're giving you is your MDM and your time. So I'm continuing on the tradition, taking this over and putting it in my notes for next year, which will be available in the link in bio if y'all need them. They're just not done yet. I did get the ICD-10 guidelines done for 2022, and those are posted, and they have lots of examples that go along with them. I just do not have the CPT codes yet done. Working on it. So let's look at this question right here. For process of elimination, of course, you know, what I like to do for the CPC exam is, we know that we only have 120 seconds per question, and it's going to be super, super hard to look up all the codes and read the question and decide what the answer is in that time frame. So what I do to cut down on that time is I go in here and look at the numbers numerically first, eliminate the one question or two questions or possible answers that are not like the others, find two that are similar, very similar, maybe one minute difference in it, and check those out to pick those. I'm going to eliminate B because it starts out with the 2 at the end and the rest start out with a 1. Technically, don't really need to look up the first code because it's in all the answers. And knowing what it says makes no difference. These two are the same. One of them will say times 1. Do you ever times 1 something? That's kind of weird. Or would you times 2 it if it's going to be something? You don't write times 1, you just write the number. So look for errors that will eliminate something based off, that's just not plausible. I'm going to get rid of that one too. So the only ones that I have are going to be the difference between the 84 and the 92. So this is going to be where I want to rely on my codes. So I want to go to the first one in numerical order, which will be that one, the 99184. And then the 99292. 99292 is under our critical care. We love critical care. Critical care is super easy if we are going to be in critical care. You can ignore everything that's written in these descriptions for these two codes. Don't ever look at any of that. Just pay attention to the codes. You're going to always, for critical care, you're going to go to the chart and find your answer by just finding in the question how many minutes. That's the only thing you need to look for. And then the chart will tell you exactly what to write. Don't ever read what's here. Don't ever try to decipher the 30 minutes from 74 and then have 74 be a deciding factor to note whether you need to have this add-on code or not. It won't add up correctly. So ignore everything that's written here. Everything. Only keep up with that chart. And it's super easy. Find the minutes. Find the minutes in the chart. Code it exactly like they say. Except for don't pick the times 1. You know, just write down that number once and that number once. That's silly. I don't know why they have that there. But right here is our test question. We've got 120 minutes. We're going to look up the 120, which is this one right here. It says do the 91 and then 92 times 2. The only one that has that is D. We don't even care what the last answer is because that is absolutely the only answer it could be. So we'll mark D and move on to our next question. You need to be able to evaluate these numbers numerically and look for logical coding errors like modifiers that shouldn't be there, a times 2 when it could be possibly more like an add-on code or you need a modifier. If you see integumentary section items listed where you have numerically smaller CPT numbers before bigger numbers in the book, and I'm talking about, like, you have your 11000 listed as a possible answer, and then your second answer in a scenario like A is 111000, and then your second answer for A is 17270. You know that's going to be wrong because you always bill the more extensive surgery before you bill something minor, like a small debridement on something, versus this destroying of a lesion and fixing and repairing all that mess. You're always going to code the more difficult issue. Washing out a wound is not that big of a deal when you're destroying lesions and it's malignant. So if you see numerically something in integumentary that is out of order, the bigger, and I mean numerically bigger, will have to be a secondary code. These codes will always be billed if they do this procedure and that procedure. That one will always be second. This one will always be first because it's a bigger build-up procedure. So look for those errors after you evaluate them numerically. You should get that done in at least 10 seconds. Practice it a bunch, somewhere around there. Then you need to run to your codes. Look at those two codes, see where they're at. Look for their headers before you read anything in their descriptions. Go straight to their headers. Sometimes their headers are on previous pages. So like these two don't have headers here. You would have to go back to find out they're under burns. So if you're here. And then if you were picking up these codes on this other side to compare with the other codes, you're under destruction. Then all you have to do when you get to the test question is remember burns and destruction, burns and destruction. Go to the test question, do a reverse, meaning you look at the last sentence in the question, do a word search for destruction or burn type, aka words. When you find something that matches with burns, good, you're golden. Circle that answer and move on to the next question. That process will help you out a whole bunch. Some questions are going to be more difficult, but you can get through 75% of those questions doing this process without having to spend a lot of time worrying over every single question and dealing with a ton of information and searching up stuff. This will help you out a whole bunch to get super fast and have some spare time left over. If we're looking at this question, get my little drawer out. We got lots of things that end in 5, which I like a whole lot. Can't draw a straight line tonight. We've got a lot of 992s too, so the only difference is the 0, 1, 4, and 5. Since they're super close, we'll just go take a gander at those. We know this one's going to be a new patient, right? Kind of have to, and this one's going to be the established, and then what's the 45 and 55? So 99245. Be sure and let me know if there's any types of questions you want to go over tonight. I'm happy to switch tracks and move on to something a little different. 99245. (99245) is under office consultations, and 55 is over at inpatient consultations, office consultations, inpatient consultations. So we'll peruse up, make sure the last sentence isn't something like just code this procedure or something. I just want to make sure we are coding a visit. Yep. And we're only looking for Myers, so don't look at any other doctor. Yeah, let's see. We've got a comp and a high. And let's see, he has been told that he has a diabetic foot ulcer and needs to be hospitalized in his condition. He decided to get a second opinion. So he did not go to the hospital. So we can definitely get rid of the inpatient one, which is the 5-5. Super quick. He is going to be a new patient, right? So this one's looking a whole lot better. But what do we do about that little 45 here? Does it qualify for office consultations? Would you use that code for that? The tricky thing is here is to be able to use these office consultations. The number one thing you need to know is that it has to be the request of the physician to have sent him to here to get this particular consultation. Any of these for new or established, it doesn't matter, but they're office consultations. The key takeaway is that they need to have been requested a rendering report, aka meaning one MD to another. One doc said, hey, come see my patient, to another doc is what needs to happen with these. So does this one qualify for that? Since the patient said that the patient wanted the second opinion. He decided to get a second opinion and went to see Myers all on his own. So that would not qualify for the office consultation. They're just trying to trick you on that one. I don't know where my notes keep going on this. All my electronics is working so weird today. So we know they're not going to be an established patient with Dr. Myers because they've not seen him. They're getting a second opinion. So you know now off the top of your head that it's definitely going to be 05 because the O's in that last column mean for new patient. So B will be your answer and move on. I hope that was helpful to explain a little bit about this office and other outpatient consultations. I'm going to check up with messages. Be right back. Oops. No, I'm not ending live. Hey, Coupon, Cutie, Kimmy, Nurse, Ange, Val, Connor, Lisa, thank you. Lenice, Connor A, 245 is also telemedicine. Interesting. Yeah, anything with, it may be in the new book written out that way, but they usually have a telemedicine. Is that star? Any code with this star is a telemedicine code that they can do over the phone, and I believe the whole set seems to have that star. Ooh. Stuff is flying out from underneath. There we go. Get another one up. I think I did this one last time. I'm gonna skip it. It's the one where we did the transfer in the ambulance. Where can you report ophthalmology, eye doctor services, or evaluation and management services? Where are those coded? If you go see an eye doctor, are they billing a 99215 or a 99205? Are they up here? Is my question. Thank Linaz. Thank you, thank you, thank you. Ophthalmology, office visits, also your physical therapy, occupational therapy, your cochlear ear implants, hearing aid office consults, all that's back here in the middle of medicine, or not really in the middle, but they're all over. We've got this medicine section that covers a lot of things, not only just medicine, but it also does physical medicine like rehabilitation, rehab, occupational therapy, like I said, their office visits, their evaluations, their setup, their re-evals are all back here in medicine. So if you're looking for their E&M visits, is what you're looking for, they're all going to be back here in the very back of the book. All your athletic training evaluations, stuff like that are back here. You're also going to have all your nutrition therapy, your psychological counseling. Some of those are going to be back here. I know there's some in the front in the E&M for being in a psych ward or something like that. But most of that stuff is back here. And don't forget about all that when you're studying E&M, that you've got some back here that are going to be for those specialty eye doctors, allergy clinics, those kind of things. What I would call their E&M visits for evaluating them and seeing them is all back here in medicine. For sure. And if you do have a copy of my notes and you have cardiology that goes along with, let's see, where's cardiology? Cardiology. You've got this page, cardiology, that notes all these B1A2, 3DC4. This page goes with a medicine page in the back with all that writing, which is a little crazy, but that's where your 4, 6, 5. It's just telling you exactly where on the heart that procedure is in case you needed a visual of where they are. But that's what this this one page is colored up and has those numbers for. It's related to that. I didn't say refer to page whatever. I should have. So 2022 notes will definitely have that. But I just, I wrote what the branches are down here. But I guess I should have said, hey, you can get a visual over there on that other page. Sometimes y'all got to yell at me if nothing's making sense and let me know if you see something in my notes that is difficult to understand. Because what I think is easy to understand could be totally different from you guys. And I'm not meaning to not clue you in on something, but sometimes after I see it over and over again, hey, I wonder if they know that. Just like some of your office visits for Medicare patients, for their pap smears or annual wellness, they're not in here either. They're over in the HitPix book, so don't forget that. You've got some G codes that will be part of your E&M visits too, for strictly Medicare patients. Here's another one. And we did this one in a previous live for its modifier, but I'll do this one for its E&M code. And you'll know better now about how to code this one. Actually, it's kind of tricky. It's another one where AAPC is really trying to trick you. So anyway, this one right here for process of elimination. Come on, Mousy. There we go. You know, we've got the 42 and the 43 and the 53. They're all really, really close. You'd think that 203 is not going to be anywhere near it. Let's see. Main issue is with the office visits. I can't find them. The Z category? I have to go and I will ask you later. Thank you for your time. The Z category. Probably meaning anemia, right? Or chemotherapy, radiation. What do you do when they're coming in for chemo radiation? You're talking about the Z51 code. I wonder if that's what she's wanting. So this one is, I'm going to go back to those 99242s. So we're back under office consultation for the 4-2, the 4-3, the 5-3 is inpatient, if you remember from last time, and the 0-3 is just a regular established, very front of the book, new patient. Oh, you're taking your test Saturday for the second time. You can email me at codingbyjen. Let's see. CODING by Jen, just Jen, Jennifer, at Gmail. It's all one word. And your results based off of your sections of the CPT book. And I can try to send you some information through the email to let you know what 3 areas you need to study with. And I'm sure you know which ones are, but direct you to the information, send you some information on those 3 areas that I think could help you too. So I don't mind doing that. Send me your results and let me see if I can't boost up your bottom 3 for you. So we're going to take a gander at this question. to see. We do see it says second opinion. This one says for an insurance company sent them. So knowing what you know about the consultations, when it says an MD sent them, well, it'd be for all of them, the in-hospital one too. Would any of those three qualify for that, because it says the insurance company is requesting that? For these three, those are all under the consult tab in the E&M section. Do any of those three qualify? It doesn't actually. So if you see insurance company, second opinion, it's going to end up being a new patient code. It'll have a 0 in it right before the last number. So no matter whatever it says, sorry, I got crap all linked up. So no matter what it says, the 0 will need to be in that one too. So don't let AAPC trick you. If the patient referred himself to get a second opinion, it'll be an O number in the E&M, and then it'll also be that way if the insurance company asked for it. So I hope that's helpful. You're welcome, Clay. Email away. Happy to help. Oops. Happy to help. Happy to help. We did collect $15 from my last live Friday night of gifts, and I'm going to put it in a grant type thing. So if anybody wants a copy of my notes and is in need but low of funds, we can use that money for gifting out the notes too. So that's fun. Now that I'm in the Creators Fund, so that is super exciting. Be able to do that. Let's see. I was working with some CCS people this afternoon for a documentation dissection. I don't know if any of those people are here, but I had this example of a cardiac procedure with the hemorrhage, and what the CCS people have to do is they have to take a long note like this, and they don't get any A, B, C, or D. They have to code it straight from this. And they have the last part of their CCS exam. I'm not sure how many questions, thank you for the TikTok gifts, are related to this. But it is super scary because they have to bank and save time to be able to do these for that at the end of their test. Yeah, they have quite a few. I don't know if it's 5 or 10. I can't remember off the top of my head right now. I've had a long weekend already, and it hasn't even barely started. But plus I injured my back, so I was on a bunch of pain meds, and it just gives me brain fog. You know, I was only on ibuprofen and naproxen and Tylenol, but the steroids, woo, they make me, yeah, crazy. So I'm better today, thank goodness. But yeah, this looks horrifying. So if you ever wanted to go for your CCS, they do not get repeat test either, and they don't get any extra time to do this. So my best suggestions are to always, of course, let's see, we are going to go, of course, and make sure we make note first right away of what was the preoperative diagnosis, what was the post. You're going to have to go find these diagnoses like you are a normal coder too. You're going to have to go to the index. You're going to have to verify the index, then go to the back tabular list and make sure that you're in the right sections, and then do the same for your CPTs. So what operations were performed, right? We're going to go here. What did they do? What repair did they do? Right here, we're going to have to code all this stuff and all those diagnoses for sure. There's going to be some things in this note that we need to take care of too, but we don't need like every single word. I do need to know a lot of times what instrument we used, or what direction we used that instrument in. So I try not to read every word, of course. I'm skipping around to look for key terms, and you have to practice this. That would be important. Y'all remember in some of these CPTs that we go over, and I'm always telling you about key terms, tunneling, non-tunneled. There's another one, indwelling. That one right there is always something key in that when you're picking out CPT codes. You need to keep practicing looking up key terms that could help out. Anything that might tell you which kind of leads, because your leads in most of your cardiac procedures are divided into arterial or ventricle or a combo of both. And just like with your cabbages, you have arterial cabbages, you have arterial and ventricular cabbages, and then you have just venous cabbages. Then you only need to pick out the grafts that you're going to have. 1 graft, 2 graft, 3 graft with each one. You just have to make sure you're in the right area. I'll show you that in just a minute. But we don't need to know how old. We don't need to know, unfortunately, during whatever, I don't know. We don't need to know a lot of this stuff. We do need to know she did go into cardiac arrest. They did do some CPR. So they may have had to DC and stop a procedure and be unable to take care of her. She was quite unstable. So a description of the surgery that they did. They positioned her. You need to know which position she was in when she went in. We're going to go midline, right? That's super important. Usually, I'm sure I'm going to miss quite a few things, sorry, that need to be done, but these are the things that I would do quickly. Patient's right ventricle had a tear. I love every time I see the word ventricle, right and left directions, I'm going to make sure that I know that. She had something to the left anterior also. And then she also had this team come in, which might be appropriate to know, because remember, if you need a modifier for your dual physicians, dual teams, you might have something in the 80s or the 66 that you need to know. So those things could be needed. And it said right here, still had an arterial lead in place. With her chest was open. They have to do all this really fast. Y'all need to get, they did not indicate that she would need a bypass, so we're not going to have to worry about coding a heart and lung machine or things like that. It looks like they did have some consultations, and they felt like a fluoroscope guided removal of that arterial lead was going to be the best. And they did get some dictation about that. So after the lead was removed, they did do it by that. It looked in good condition. was no evidence of bleeding. Good, good, good. Her heart was placed back in the usual fashion. Gotta love the doctor's talk right there. And you need to know what all that means. They gave her some Bactrim to warm up the heart. So we've got some medications here that are going to be given. Chest tubes were inserted right here. In what size? They did some pacing in the usual fashion and a stab incision. They did closer with some steel wire. Ooh. And they did a sponge count, blah, blah, blah. She did get 2 liters and 3 something of blood. In the operating room, they did a lab. And she had 82 hours of that. She was kept intubated and will be followed closely for the recovery for significant things. Okay, let's check my highlights to what the school highlights said they should have been, which is here. So I got that. I got that. I think I missed something there. Pericardium? I missed the pericardium. Yep. Pericardium unstable. I knew that. I already had. Okay. I already had that she was stable in one place. But they wanted to know about where it was opened, the scalpel, right ventricle, left ventricle tear. I know I got those. Right ventricle, left ventricle. Did I get the electrography? They didn't care about it there. They cared about this, that they gave her CPR. I did get that. I kept it a lot lighter with the words. Upon inspection, they did find some bleeding. They put a stitch in it. Chest tubes were put. I did put that down. And that stuff. They are going to end up having to code 15, is it? 15 things right here. The diagnosis of medical necessity of the procedure performed by different surgeons. I was right about that. The cardiac arrest, the inoperative bleeding, her medications, her position, her chest was opened, her hemorrhaging, her blood pressure stabilizers, her right ventricle lead was removed. There was a tear in her suture. They're going to have to code her CPR and billed by the cardiac surgeons. Additional bleeding controls, chest tube, closure site, x-rays, because she had the fluoroscope, and blood transfusion, and then her post-operative stat. So her procedure code is just that simple one. And then there's her ICD-10s right there. And then they give us all the rationale. It's just a lot. They are supposed to note all of this crap just to get the one little OCPT with the modifier. But imagine having to dissect 5 or 10 of these at the end of your CPC exam for those people that have taken the CPC exam. I have some more examples like this for the CCS people. If they want to go over more of these, I can. I wanted to go over for my CPC people a little bit of cardiology for my cabbages. Cabbages was one of those things was so scary to learn about. I actually did CPR on a patient who died in the gutter. He was 1 week post Cabbage, and he was coming back to our hospital outpatient services for a follow-up, and he got to the appointment pretty much on time, but on the way to the visit, the wife noticed him gurgling in the passenger seat and wasn't doing so well, and she pulled up on the curb and rushed into our OB center, because we were in the OB center. I was doing OB and delivery at the time, and we pulled the crash cart out on the sidewalk and pulled him out. And literally he was on those grates, you know, that lead into the gutter, but California, it doesn't ever rain there, so it was fine. But we were doing CPR and all that stuff right there. The hospital's on the other side of the road, and we're there, and we never did get anything. It sounded like he was talking a little bit, but that was the movement of the air through your vocal cords as we're doing CPR. And I was like newbie. So knowing that you do that when you're not meaning to do that, when it's just air, is kind of weird, because you think, oh, they're okay, they're talking, they're mumbling. But no, you gotta make sure you're checking the pulse and the respirations and stuff, because that's not real voice. They're not really making that on their own. Anyway, so every time I think of cabbages, I think of that guy we worked on, and it was rough. This one right here. So when you get to cabbages, I'm on page 257. That was 20 something years ago, and I still think of him every time I think of cabbages. You never forget your first real crash CPR, you know. It's crazy. It starts out with cabbages being venous. These are your venous cabbages. If you're under the right heading, then all you have to do is pick out how many grafts. 1, 2, 3, 4, 5 on your question. Turn to the next page. We start out with our combined arterial and venous cabbages. And again, if you're under that heading, they're going to be single, 1, 2, 3, 4, 5. And then here is the start of your just plain artery grafting cabbages. And your singles here, and then your multi are right there. So I've took different highlights, boxed them in, and then boxed in just the combos, and then boxed in just the venous. Their pictures don't go along with the right ones, but don't worry about the pictures. You don't need those. What you need to know is to make sure your first word in each one of those is correct, because your test question will say they're doing arterial or venous cabbage, or they're just doing a venous, or they're just doing an arterial. That's it. That's the special thing about cabbages. There's 3 types. Get underneath the right heading, then you're good to go for whatever kind of graft they did. Just find out how many grafts they did in your keyword search, and you're good. Sorry, Hetty, if that was crazy. Me and my stories. Hello, Pisces 22222. The cabbages are not that bad of a deal. Just make sure you're under the right heading for those. Remember, your critical care tonight includes a lot of things like EKGs, a lot of things that you might normally, chest x-rays and things like that, you want to bill for separately. You don't need to do that with these when you're in the critical care. We went over some office consultations, so don't let them make you think that you need to pick those office consultation visit codes in the 9924s, because it has to be a referral from doctor to doctor. It can't be the insurance company requesting it. It can't be the patient deciding to get a second opinion. Those all get bumped down to just a regular new patient visit. And what else can I tell you about cardiology without stressing you out too much? I got a recent question, I think, about the defibrillator. Was that close? I think that was close to Cabbage's. That was hard for me to tell the difference in it with the way it was worded. I thought it was near the Cabbages. And I kept going so far past the Cabbages that maybe I went too far, but no. Maybe it was before the Cabbages. Some more billing information for Medicare down here. If you happen to be billing for a TAVR for Medicare, they are only using those 5 codes when you bill. And the place of service needs to be 21. Your modifier is going to be 62 for multiple, probably physicians. And I found that information, and I thought that would be good for billers that are going into cardiology. Somebody recently told me that was their hope that they wanted to go into, and that would be valuable information for them. Also knowing that all these CPT codes from 33206 through 33249, there's about 43 codes there. They all include radiology fluoroscope. So don't let AAPC or AHEMA make you think that you need to add a 77 code to those, because they include radiology, and they don't do any kind of a good job telling you that it includes it. Like, let's see, the 4th, yeah, that one would include fluoroscope. They don't tell you nothing here. So this one too, the 49, is the last one that does include fluoroscope. It's the defibrillator I was looking for. It also includes fluoroscope radiology. It doesn't say it anywhere in there. The wording on the question started out with the dual chamber, and then it said transvenous, and then it said implantation in the question, and then it said defibrillator. That's the code. They tried to add fluoroscope to it to trick you, and it doesn't need to be added to this question, to that CPT code, because it's already in there. So be sure that you have that information written in, because that will help you, especially on the CPC exam. If you get the one that has that. Is Jess in here tonight? I know she is fixing to take another exam. She has had CPC exam A and C, and she wanted some B information, and I do have that. I was told your site, if I purchase some notes, will be able to download immediately. Yes, absolutely. If you want a copy of my notes word for word, you can download them instantly from Etsy, and you'll get an email, and you click on a word in the email and it automatically downloads it. It won't send you the PDF attachment in the email, so it's a little confusing, but nobody has any trouble. If you do, I'm just a click away. Let me know you don't know what you're doing and you need help, because the site can, if you've never bought a PDF from a website, it can be confusing, I'm sure. Let's see, I've got, I think, here. So Etsy is where they're at. It's Medical Coding by Jen, and you just click on it, purchase whatever you want, and it'll say the word download on your email. Click on that word download, even though it doesn't look kind of clickable. It's weird. But that will start your download of your sections. Etsy has a website restriction on how much file size I can make these, so they won't let me do like a whole entire book at one time for one PDF. I have to even break up the sections into little bitty parts. So, and they'll only let me have 5 uploads per ad or listing. So I have to make sure that the files for one whole section like cardiology will at least fit into 5 uploads. So I'm building my own website. Hopefully I can get everything over there where y'all can just do one download and have the whole thing. That would be better. It also has, if you go to it and you don't even sign up, but you just scroll down the first page when you get there, in the middle of it, I have a 10-question E&M free quiz there. It's pretty tough. It's real tough because it's for coders who are already coders. Right there, you can view screenshots of my book, and it'll show you how to box, highlight, annotate, fix your sequencing issue for the out of sequence codes, and how to add examples so that you can get your book noted properly for your CPC exam or medical coding exam. It'll also show you how to Google Lens the pictures that are in this book, and you can add to the anatomy in them like I did, so that you have more information during your exam than what's given here. Like they drew the parts of the celiac trunk and the diaphragm and the superior mesentery arteries, but they didn't label them. You need to have more information than what they have on their little pictures. You need to also add in your prefixes, your suffixes, your common medical terminology in the beginning of each section related to that section, so that you have it for the exam. It's a lot of prep work goes into this. I also put in the top HitPix codes, top modifiers per section, top diagnosis codes for sections, that kind of thing. Anything that can help you out, because 100 of your questions are going to be from the CPT book. Then you're going to have some HitPix and some ICD-10. You're going to have some anatomy, which hopefully you can get it all in here so you can find it here. You're not having to switch around to a bunch of books. You need to not forget about your abbreviations that are on the back cover of your book. They have recently picked out IVC on exam C, which right here, IVC is inferior vena cava. They also had ESRD, end-stage renal disease. So don't forget these are back here, and you can add to these. Anytime you find an abbreviation for something you don't see that's back here, you can add any of the A's up here near the A's, B's, C's. Try to keep them in order if you can, so that you can find that information fast. I have a modifier cheat sheet that I like to keep at the back of E&Ms, but a lot of people like to use the one on the front cover of the book. So don't forget these are here. They also have all the I's and everything listed pretty much right here. Even some of the anesthesia ones are here, but you really need to have those Q's for the modifiers. There are the modifiers for the anesthesia being monitored or something like that. So we need to make sure you have these modifiers listed in this book. They're in the HitPix book, but they use these on the CPC exam, AA, QS, G8, G9, QX, QY, QZ, and AD. Those are all used. You've got some discontinued anesthesia modifiers, and then your regular CPT modifier. So be sure you've added up some more information into your book. You can also schedule some one-on-one with me in my books before you get, if you're down to the last 2 weeks before your CPC exam, that's a real good time to schedule one-on-one tutoring with me in my books. Tell me what your low parts are and where you want to go over, and you can schedule that there. I'm trying to click on the link to see if it'll go there. But I don't know if it'll go there on my phone because I sent her the link. Let's see. No, I don't want to go there. Services, there we go. There it is. It's $27, and 40 minutes was the limit for Zoom. It said I had to have, because I don't own a Zoom account or pay for Zoom. Everybody thinks it's free, but it's not. It wants you to have one if you're going to be over 40 minutes on a Zoom. But every Zoom I've had have been like an hour and a half with everybody, and they don't cut you off. So for right now, I'm using the free one, and it's just me and my books, and we go through whatever sections you want to go through in about an hour and a half. And if you want to do any kind of tutoring with you and a buddy, and then I've been a guest speaker for AAPC and taught 2 classes so far on an academic level, so that's always fun too. But I'm happy to work with anybody there. But the blog post, I'm not sure why they're not showing up, but I have those on there too. The online programs is where you want to go for doing the first 3 steps of your book, and then the 4th step of prepping your book. So those will show you how to get this book the way mine is for free. So you can go there for that. We also have a Messenger chat group. If you come find me on Messenger, which I think it's a Facebook thing, but you can have just Messenger by itself. You don't have to have Facebook, but that is my personal Facebook account. It doesn't matter to me. Y'all know who I am. But I'm Jen, and you can come find me there. That's my name and how you spell it when you find me. And then when you do, ask me to join my study chat group. We talk every day, all day long, about all kinds of codes, and I quiz people all day, all the time. You can do a search by photos, and if you join the group, you can get copies of whatever we've shared or I've shared for prepping your books appropriately. We share all kinds of information. So all that's there. You won't be ready for this group until you're about 3 months away from taking your exam. Then you need to come here. If you're brand new, just now thinking about becoming a coder, and you are way new, stick with your AAPC Facebook group. They can direct you to finding all the information that you need and gathering up and getting started with your even self-practice. If you want to go self route and not pay for a course, which I recommend, you can start here. It'll tell you all about what's on the exam, what to expect, all the new stuff, what books to get, what to study, that kind of thing. And then when you ready to really sit down and start prepping for the exam, come to my group and I will help out. If you want to self-study for the exam, all I recommend getting is the AAPC study guide. Even if it's a previous year, they haven't really updated it since 2019, but it's wonderful. It's got tons of information that's directly related to the CPC exam. Whichever certification you're going to get, COC, CIC, CPC, whatever, just get their study guide. Don't buy their course. But the study guide will have everything you need to know in it for their exam. Study it for sure. Know it front and back. Add all this anatomy, the extra pictures and everything to your books. All that good stuff that's in here. They're even going to have exam questions in it. You can add those clinical examples to the CPT codes that they're directly related to. It'll teach you about the laws, the governing bodies. It'll even encourage you to write in your books, meaning your CPT and ICD-10 books. It'll encourage you to move this information from there to here. Your acronyms, make sure you know those. If you don't want to do flashcards and memorize all this stuff, because you will drive yourself crazy and you'll get brain fatigue, all you need to do is look in the back cover of your CPT book. If it's not already there, write it near whichever alphabetical it is. Collect all that information. It is an open book exam. Then all you got to do is know exactly where you put that information and go straight to that information and look it up. So don't start doing all craziness. Get your information written out and put where it should be. Keep organized and get ready for that exam. Let's see. What else do? I have these lives, which I do on TikTok. I try to do them Mondays, Fridays, and Sundays. I got pixels that popped up in my phone. It's driving me nuts. Some dead pixels. They won't go away. Anyway, they're sparkly. Looks like a little rainbow. I post these lives on YouTube. So you can come find me on Coding by Jen on YouTube. And all the previous TikToks are there. If TikTok recorded it, sometimes there's glitches and they don't record them. And I lose that information forever. But if it was recorded, I post them there. And it's the entire thing. Whether I'm talking for 1 hour or 3 hours, it's all there. Usually just divided up by date. I try to make some comments about what I went over, but mostly it's 3 hours of me rattling on, going from one question to another question, trying to teach the process of elimination and answer questions as they come in. So you can go there and see more of the process of elimination. Of course, more of the books too. And happy to make that available too. Absolutely. Let's see, what else do we have? Thank you about loving my notes. But I can, if you have any trouble downloading those notes, let me know. I'll be glad to just send them to you directly too. reply to a message. So any information, if you use Google Lens, I have an Android. I still haven't transferred over to all that Apple stuff. But, and luckily everybody, all my jobs are all, but if you do Lens, it's a download, and I'm sure Apple will have something like it. Do Lens, and you take a picture of a picture inside your book, like that, and then you hit search. Come on. I don't know, my screen is like being all crazy today. Search. It comes up with a list of stuff, and you can find one that might have more stuff drawn on it and tell you more information. And then you click on it, it'll take you right to it, and then you can add that information to it, just like I did. Super cool. I like it. I use it for all the different pictures here, and then add whatever else I can find. I just do a Google search of common prefixes for integumentary, or common prefixes for musculoskeletal. I'll get those, add those there, the abbreviations and all that stuff that go with this area. Also draw in extra body parts that aren't labeled that should be. AKA terms for things. They're called vertebral bodies here, but the test questions will call them segments or interspaces, so I make notes of that kind of stuff. How many are in each section? Don't know if I've ever needed that information for the CPC exam, but I have it there just in case. How many bones? Drawing in more body parts that weren't listed. Things like that. I have a crushing injury to these two fingers that I've been dealing with since July. I can no longer bend those knuckles like I can all my other knuckles because I fell with my flippy phone in my hand like that. And when I hit the back of those knuckles like that and caused a crushing injury. And a lot of that you're going to need to know that I have an injury in the 4th and 5th. My kids are slamming doors. My 4th and 5th middle proximal phalanges. I did the report today. It was funny. It's like, well, we can code this. This part of your finger is called distal. This one is middle, and this is proximal. So this one is called the PIP joint. Is it in that joint right there? I think this one's MIP and PIP, and I forget what this one is. But that is what we have right there. You will need to know those for those trigger finger injections to know which area they're trigger finger injections. That will come in handy for sure. Didn't I have? I did. Oops. Nope. Wrong one. So you've got the 5th proximal pharynx finger, right? The 5th distal interphalangeal joint, that's the PIP joint. A lesser extent to the 3rd digital flexor tendon as well. Huh. But that's it. It was interesting. You just need to make sure that you know that whole, if they're talking about a phalanx, they're talking about the hand. We're talking about sesamoids. We're talking about feet. Those kind of things is what we're keeping up with from exam to exam. Let's see, can I open up my little tracker? Let's see, exam A is what I'm looking for, but I have everything on it. Exam A. This is the one that we've been keeping track of what is on version A, B, and C of the CPC exams. And here we go. This is information coming back from everybody that took the exam in October. And somebody taking exam A said that sesamoid bone was on their exam. Also, Medicare covers nursing facilities in what part? Need to know that information. What is a venous valves? And that's actually with the musculoskeletal. It helps your joints move. So you can see that they're trying to make you think that it's cardiology, right? This word was on exam A. Need to know your sepsis guidelines. What does ARDS stand for? What is an ABN? There's the phalanx. They had a scenario where they needed a code for a triple delivery. You need to make sure that you realize you need to have your 7th character as 3 because you've got triplets. If it was twins, it'd be 2. There's an added code that you'll use for multiple gestation in addition, and I put some examples down for that. How do you code multiple guidelines for once, like injury and HIV, or injury and pregnancy? So whatever they're being seen for is what you will code for. So if they are seen for a fracture in their ankle, they're pregnant with HIV status, you're going to code their ankle injury first. You'll do their pregnancy, and then you'll do their HIV status according to the guidelines in your ICD-10 book. Let's see if I can get this back up here so it's not shaking all over the place from me moving around so much. If their cancer has metastasized from one site to another, say they started out with brain cancer and it went to their lymph nodes and now it's in their lungs, whichever one they're being seen for that specialty, you're going to code first. So if they're being seen by a lung specialist, pulmonologist, for their metastasized lung cancer, that one will go first. Your primary cancer in the brain will go second, and then your other metastasized to the lymph nodes will go third. You'll just need to know those guidelines so you can pick out the right A, B, C, or D answer that's typed out in the right scenario. In test B, there seemed to be a lot of urine. Urethral blockage. What happens when you have one of those? And I put down the most 4 common diagnoses with those. There was a split thickness graft versus full thickness graft scenarios, so I defined those. Skin grafting. There's 3 different types of skin grafting: autograft, allograft, and xenograft. Be sure you know those 3. The split thickness autografts are between these codes and those codes. The full thickness grafts are between those codes and those codes. Yeah, I know. It depends on the manifestations, yeah, on the metastasize, if they're seeing a lung specialist for a metastasized lung, you will code that one first. Let me show you. Where am I at? Those guidelines are a bear, guys. It's going to be on page, if you're in 2021 guidelines, that one will be on page G10. Down at the very, very bottom. Right here, you will do your secondary first malignancy. Then your primary malignancy will go second. And that is right here. When they are being treated for a secondary site, the treatment for that visit with their pulmonologist is for their secondary site. The secondary neoplasm is principal, even if the primary malignancy is still present. No worries. It gets crazy. There's so much. I mean, that's just 3 little sentences in all this nightmare of mess for 1 page. There's 33 pages of this stuff. And it's so much information in every sentence. And then they'll switch it and switch it and switch it and flip the scenario and go from one thing to crazy another thing. If it's anemia due to chemo and emo, it's this one. If it's radiology, and they have anemia, it's that one and that one. Dehydration and malignancy. Then if they have malignancy and anemia due to the malignancy, if it's due to the treatment for the malignancy, it's done a different way. Cancer is a bear. And there's a lot of information there. That's why the notes are super helpful, because I have the examples written out there. But I also like to be able to talk about them and tell you often how they're coded. Come on, get up underneath there. All right. So making sure you know what types of grafting there is in the split thickness grafts, and then knowing which codes are for split and which ones are for full is helpful. Then it's just divided up by location. The split thickness is abbreviated at STSG. The full thickness is abbreviated as FTSG. And then I have them again listed here in the different body parts by the different, and separated by the different stages. Knowing your CKD stages and how to diagnose them in different scenarios was on exam B. The modifiers that were on exam B were 53, 22, 52, and 59, the dreaded 59. And I wrote out the definitions for each one of those and did some examples of those on how to code them. I did some more information about modifiers. I listed them all out in this little area as payment modifiers. These modifiers just deal with the money. They change the situation by money. And then these change by location, the body part. What modifiers do is actually modify the CPT code's descriptor. So if the descriptor doesn't say it's one or the other, bilateral or that there was 2 physicians that worked on that one bone. If we're updating or changing that CPT code, that's why we would use these modifiers. Let's see. I'm looking to take my exam in January, February. Should I go ahead and buy the new books? Not the new guide, absolutely not, because the guide hasn't even updated since 2019. If you update a book, only update your CPT book. Don't update your ICD-10 or your HitPicks. Those don't change very much at all, and there's only 5 HitPicks questions, and there's only 10 ICD-10 questions. That won't be beneficial at all. I think you'd be okay with the old book till March to take your exam. But you never know. They may be ready and change the exam January 1st. I don't work for them. I do some guest education for them, but I'm not privy to that information. As far as I know, they're pretty slow about updating stuff. Really slow. So I think you'd be just fine. But if you ever wanted to update anything, just do the CPT. Don't buy the whole new set. Yeah, my guidelines look crazy. I redid the guidelines in, let's see, do I even have them up? I know I'm working on so much stuff. No, I don't have them up. But I did do, I'm working on the notes for the books all typed this year instead of doing them all off the books and you having to read my handwriting. Oh Lord, I know that's been a challenge for a lot of you, and I'm sorry about that, and it's a challenge to take a picture of something, turn it into a PDF, and then get it printed out, because sometimes just taking a picture of something and turning it into a PDF can modify its visuality. So I am typing all of this mess out for 2022 this year. And where is... not that one. Don't know why, but is it going to open? I don't know if it's going to open. I probably broke the computer. I'm trying to open up all my 2022 guidelines are not written in the book this year. I typed them all out and put them on Etsy, but they're super cool with the way I did it. I took the page and divided it into 3/4. So this part is the guideline. I highlighted it the same way, but electronically, which is neater. And then in the 3/4 side over here, I put all those examples down. You know, if it's this way, you code it that way, with an actual real codes that go there to show you. Let's see. I only did 2 sections, immunizations and respiratory last year, typing those out myself. But this year I have the ambitious plan to do all the sections myself. But as you can see, it's going to have coding tips to the side, examples of how to code it, and any documentation issues that might come up with that particular guideline, it'll tell you. And then I still have it all highlighted like you should do in your book, so that you'll know how to continue on doing it that way. But I did the guidelines that way. Even if you have the 2021 books, there are some additions. We now have the social determination section for 2022, like if a patient is homeless or they have food issues, like they don't have enough to eat, that information we can now code. We have a new section for that. But other than that, they didn't take away anything, so it's all there. But I did screenshots of the regular book, like if they're talking about this particular thing excludes and includes, and to explain it better, I took a picture of the book, did an explanation, pointed out what they're talking about so that you would know. Hopefully that's going to be a lot better to read and decipher than all my madness I have over here written in, and y'all trying to read all my handwriting from last year. So yeah, I'm pretty proud of it. But it would help everybody out. Just be sure. There's so much I can tell y'all to make sure that you update in this book, especially in the musculoskeletal. I circle my closed words with orange. I do all the opens in green, because some of these procedures are the same bone, the same body part, the same procedure, but one of them will be open and one of them will be closed. So you need to make sure you know the differences for sure. Sitting here laying on my book and editing this page. I finally got it to open up, but I messed up the formatting. Go into a lot of detail, even for the CCS people that need to know the root operations and their qualifiers for their guidelines. My notes will help you out there too, because I've listed all that with y'all in mind too, to think about. Yeah, no, you have 7th characters even for eyes, for glaucoma. We know we have 7th character for initial, subsequent, and sequel encounters, but if you're dealing with eyes, you have another one. If you're dealing with OB, which I need to add in here, you have baby 7th qualifiers too for multiple gestations. So there's always more stuff I can add in. There's more of the screenshots and then pointing to exactly what they're talking about. And then I'll do some examples of what they mean by that. So hopefully it's really good information. Does a good job of picking up the pieces where the teachers don't explain stuff as they're rolling through some of those courses super fast. And advice on helping out with the guidelines for sure. No, the guidebook hasn't been updated at all. The test questions, even in the first section, are the same as 2019. Somebody was making comments about that. Yeah, even the practice questions that you're doing, if you bought those $400 ABC 50 question each, those haven't been updated either, so those are the same. Yeah, they are for a profit, and all that stuff to update takes a long time, so yeah, it's expensive for sure. And they've already got you for enough money as it is. I'm trying to eliminate that. Make sure you get old study guides. Don't buy a course. Learn how to fix your book so that it's ready for you during the exam. You add your examples. You add to your anatomy. You add to your vocabulary here. Practice the process of elimination. Practice finding key terms fast. Practice finding irregularities in the numbers, in the answers. You do all that, you're going to be fine. The sections that I want you to not focus so much attention on because there's so much to learn that are really difficult is, of course, lab, path, and medicine. All the other sections are so doable. You can bring up those sections and scores really well with the hit picks and your compliance. Everything that you need to know for compliance, just right in the beginning of the CPT book, and all these white spaces that you have available, and write every compliance thing down that you would need before your E&M section. I don't have a lot written in here because I didn't do that for y'all this year. I will be doing it for this year. But all these white pages, you could write a lot of your compliance information before you get to the E&M. I do have something written down in here more than what I'm showing for some reason. I'm not finding it. But any of your compliance information you can write here. And compliance will look like, oh, let me find my other. Let's see. Move this. Will be all your what does Medicare Part A, Part B, Part C, Part D pay for. All that information will be super helpful just to write it all down. I did mine not in different colors. You see how it doesn't pop out, but if I was to do this for you guys, I would write down different colors so that things would pop out when you're looking for them. All your words and abbreviations and things that you need to know, your dates of when things started. What does NCD do? That was on one of our recent exams. What is an MAC? What is local coverage determination? All this stuff that you need to know for your compliance information. Write it in these white spaces. Do a better job than I did, obviously, so you can find it a whole lot easier. But all that information is super helpful. Don't forget to know when things update in this book. And don't forget you've got your radiology positions up here in the very front of your book too. There's going to be a page right here that's got your code sets and when they update. Remember that your HitPix updates quarterly. Remember when your CPTs update and when they go into effect, or at least where to find that information, because you'll need to know that. The front of the book, where it's got the instructions on how to use it, tells you what to highlight, box, and stuff, just like what we're doing back here. Everything after the semicolon is what you highlight, and then you also highlight the stuff that's in the secondary child code. That's all helpful. In my notes, I've highlighted all the codes that were on my CPC exam or somebody I've mentored, and then I wrote in clinical examples for those. That's added benefit right there. Just knowing what's on the darn exam is always super helpful. So any information, if you are taking a course and you are doing these practice quizzes, you can take these practice examples, maybe not a huge op note, but something like this. You can get your right answer, verify it's correct, write a little scenario about what was going on here in your book. They're your books, you can write in them. Don't worry about all that. All those wives' tales that get spread out between people. None of it's true. My book looked exactly like this rainbow nightmare when I took mine. No issues at all in person or online. But you can write a scenario about, let's see, what have we got? We got an OP. Yep, we had biopsies of squamous cell carcinoma of the left ankle and a lesion. And we did a harvest split graft mesh with xenoform. How did we code it? We used a modifier 51 and we coded it with a 15100 with a 11603 with the 51. Note that the 1500 is a higher number that the 116 is. So just make sure you write your stuff in sequencing order of how it should be coded so that the example looks correct here, so you'll remember to do it that way during the exam if you happen to have one similar. But all that's helpful information. It takes a lot of time to prep the book, probably about 40 to 60 hours to get it boxed and highlighted, distinguishing the differences between the codes, writing the AKA terms, adding your clinical examples, adding to the anatomy, and adding to the definitions. But it is worth it, and it is something you're going to need because the test questions go by so fast, and they throw so much at you at one time. Practicing recognizing these numbers really will help, and knowing if something doesn't look right in their sequencing, and knowing how to look at the header versus the code description. Sometimes you don't even need to get there to the code description. If you're under the right header and that's the only possible answer that's under that header, then you're good to go. You don't even need to look at the CPT code. You just need to make sure you're under the right header. That's all super helpful right there. Yeah, basically learn on your own. If you have the money to throw at classes, if you get a free grant or something like that, then have at it. Just you'll be sorely disappointed. I've not met one person who was grateful or enjoyed or gained a lot of information that they needed for the exam for a paid course. Even with a teacher-led course, some of them are struggling really hard with that. They move so fast and they skim so fast, and they don't break it down maybe as plain wording as I do. They're all still talking in their higher education levels, I guess, maybe, and it's just fast. And if you don't have knowledge of it already, then you can't stay with her or him because they know it. They're breezing through the wording, thinking you can keep up, and it's really, really difficult. So you need that study guide is really helpful. If you do break it down, it breaks down the guidelines, it breaks down the orders, the laws, a lot of anatomy, more so than the course did. The courses are just, it's not worth $3,500, and I've not met anybody that was happy with that at all. On my website, Medical Coding by Jen is where I have the two things that say how to write up your books. So let me show that again. So if you go to Medical Coding by Jen, I have some, I have to go to my little app for the website so I can look at the website and show you. I have this thing called programs, I think. Where are we at? Yeah, active programs. I've got, first 3 steps, no time limit, right there. and the content. Step 1 is what to write in your book. Let's see. What does that look like? I'm not sure how to, but I will figure it out. There we go. And see, I'll have some screenshots and some wording that will show you. Okay, step 1, start at the beginning of your book and draw a box around each set of parent and child codes. So it'll go step by step. It'll give you some pictures of what I'm talking about, what it will look like if you need to box and your parent code starts at the bottom of one page, but then it goes to another page. What will you do then? How do you work those issues? And then when you get to the child codes on the other page, how do you refer back to the parent code? So we divide it up by columns. These child codes we know go with this parent code, and they go down to that column because you'll read from that column and then that column and then that column. So that's where all that information is at, and it'll show you step by step, and it's got little wording underneath each one. Yeah. So hopefully that's helpful, but it'll show you what to do next. Once you do all the boxing, some of them are their own core code and they don't have any children, so you don't have to worry about that. But you can do this boxing while you're mindlessly watching TV with your kids. You know, you don't have to do a whole lot with it. The next step is to find everything that's after this semicolon. Tiny little semicolon right there. In all your core codes, you'll highlight exactly what comes after and then exactly what's on its little child codes up until you can find some parentheses on either set. You don't need to do that highlighting, but if you highlight it, it's okay. Yep, that's the first things you need to do, and it'll go through a lot more steps. That's step 1. Step 2, you're going to go fix your sequencing issues. This book is in numerical order, so you'll need to go through all of them because they got a million of them that they put in out of order, and you're not going to have time during the CPC exam to go look for a range of codes to go find where they're at. Just go find them and put the page numbers down beside them. That will be the easiest one, and they're not all going to be on the same page. A lot of them are listed in 900 locations. One of them's even 700 pages away from the original set. They're all over, so you need to fix those. Put the page numbers down as your step 2. That'll take you another time. And that's where it shows you exactly what to highlight and on those codes. So get all that done first. Then you could mosey on over to step 4 of prepping your book. Once you get all that done, you're going to work on all that stuff I talked about. The opened and closed. Yep, you're going to do your E&M requirements, your do not report, your common modifiers. Sorry, it's not, and your with and withouts. I'm going to have some screenshots and stuff in there that goes with that. But all your do nots, you need to mark in red with a star beside it that says don't use it. That means you can't use this code with any of these codes along with it. AAPC will absolutely give you an answer with that code in it and that code together. They'll also do a lot of talking in the question that says radiology, fluoroscope needed to be done, blah, blah, blah. whatever this code is related to back there in radiology, and they'll make you think you got to add it with it. But the answer tells you right there, don't use it. So you need to mark all those with red. Then when it does say you need to use it, and some of these things will tell you when to use a modifier, which is a blessing, you will use a blue star and underline them. And I use a blue star also when they tell me to use a modifier with a particular CPT code. So those parenthetical notes are super important. But you only need to mark your do nots and your do's. Then your opens and closes for procedures, your common modifiers, and then up here in the front of your E&M book, you need to know an easier way to do your history, your exam, and your MDM. So we just say this is expanded, moderate. We'll do detailed, high. This will cut down on your time. Problem, straightforward, low. Doing that will help out a whole bunch. Complex, high. That will make you move through the E&M section a whole lot faster. Detailed, low. Expanded, straightforward. That kind of stuff will help you out. But that will give you, that will give you all the info. That is Medical Coding by Jen. All free information there, for sure. Posted there. I don't collect or sell any of your info. Nothing like that. I just want you to better your family's life, which will better your community and then better everybody. It's tired of seeing everybody suffer so much during COVID. It's so bad, COVID already, and then they couldn't pass the exam. Well, it's AAPC's and everybody else that's selling information on how to pass the coding courses or the CPC exam, that they're not telling you what you need to know to actually pass the exam on exam day. So that's what I'm doing here. Hopefully helping you out here with the TikToks, the messenger chat group, teaching you how to prep your book for test day. And then if you need page by page, for right now, my best section that I did is the last section I did because I was learning along the way. Modifiers is medicine. It's got everything I learned along the way that was helping people pass the exam. So if you only just want one section and then copy what I've done to all the other sections, medicine is a really good one to get. But you don't have to get anything from me. You don't have to buy anything. All my information's for free. You can watch my repeat YouTubes. I show off my books on every live. I can teach you how to prep them for prep day. I can teach you the process of elimination and word search, and work with you tutoring individually and in our chat group too. So the individually I do charge $27 for, but it's pretty good information, especially right before your exam. If you're down to the last couple of weeks, it's really helpful just to go one-on-one, and I'll let you do your mock questions on your own and do your own process of elimination. See how fast you are, see if we can get through them, see what you're missing, and give you tips and hints on what would work better for those. And I do have a practice exam from AAPC posted on Etsy. It's 150 questions of theirs with the answers on a separate sheet, so you can go through those and practice, and they're $40, a lot cheaper than what AAPC is charging. So when you get ready, you can do those for practice. And get you all ready for this lovely exam. It's nothing that you can really relate to. It's not a coding exam. There's no coding. The coding has been done for you. You just need to be able to pick the right answer really super fast within 90 seconds. So it's running from one thing to another, repeatedly bombarded for 5 hours. It's relentless. If you take it online, you can separate it out in 2 hours and 40 minutes each session. So that's really awesome. But a lot of people really love to have the book and to be able to draw on it like I do on my exam practice questions to show you the process of elimination. You can't do that online, so you have to do it all in your head. So that's another issue, but it can be done. You just have to practice it. And once you get the feel of it, you'll be really confident with it, and it works really well. And it's fun to do, actually. It's just getting over the hump of letting go of everything you've learned about coding and what you're supposed to be doing during your coding. So you just got to let go and you can do it. Yeah, the E&M section is a nightmare. And they don't match because you only need 2 or 3 to match, and you don't know which ones those are. And there's this open blanket E&M thing that if it's not stated, then you just downgrade it. So it's really frustrating. And then some of them have the same MDM, so it's hard to tell which one it is when the history and the exam don't match, but the MDM is the same. Then what do you do? So rule of thumb with E&M is to always downgrade the office visit. So if you have a choice between a 414 and a 113 or a 114, always go with the 3 for the AAPC exam. They like to see people undercode E&Ms versus overcoding. Don't pick those high numbers for any reason, like 05 or 115 or 445, critical care, any of those, unless you got a match that's 100%, you'll stand on a rock for, that's matching. Other than that, downgrade it, because even if a patient isn't stated whether they're new or established, you always downgrade them to established without the information. And a lot of those 2 of 3 or whatever that need to match, some of the review of systems that need to match to get credit for that level are very minimal, and also something that the medical assistant can do for the physician that the physician doesn't even do to qualify for that. For example, the history, when the assistant writes down they had their gallbladder removed, that they've had, a fractured left wrist, they had their tonsils taken out as a child, blah, blah, blah. They put notes down about their history. Then the doctor can just accept that as his history, part of the exam now. So the guidelines have gotten really crazy where you're looking for the physician to say something about certain reviews of systems that's already been implied through the office visit as normal. That's why they have all those wording in there, that it's just adequate history or established. What's that stupid wording? I'm blocking it because I hate it. Appropriate history was taking. Yeah, that's what they're doing. I don't know what they're doing, but I don't like it. It's not The other way was way too wordy and detailed and all this other stuff, but now it's too la-di-da. So I wish they would make up their mind. You know, do you want it like really detailed and way too complicated to do, or do you want it helter-skelter, you know, anything goes, wild, wild west? So E&M is a difficult section. It is. Yeah, y'all learn a lot you don't know from me and my big mouth. Medical terminology, if you are not in medicine ever and have no background in medicine, you do know more than you think you know, because you've been to the doctor, you've taken kids to doctors, you've taken parents to doctors, you've been to the doctor sometime or another, or an ER in your lifetime. So you do know a lot of stuff that you don't know that you do know. But if you have never been in medicine, yeah, medical terminology would be a great one to take. The hard thing about learning medicine and coding is if you are not living it daily and working in the system while learning the terminology, you will never be proficient enough to know enough to be confident in what you know. It's going to be very difficult. Just doing flashcards, just memorization, it's never going to feel enough in you because you're not working in it. Once you get a job and you're in it and you're using those terms and you're learning the jargon in real life and using it daily, then you're going to get proficient in it. So don't expect to be a medical terminology course to make you feel like you're there. Yeah, you're going to know some of the words and the definitions, but really wrapping your head around it, you need to be in the system using it. So don't spend a lot of money on whatever medical terminology course you do. There's enough YouTube videos out there. If you wanted to self-study circulatory system, you could. If you wanted to learn medical terminology on musculoskeletal, you could. You can do it all without a course. There's enough books out there on Amazon that will do a blanket medical terminology and things. You can get books at the library and for free. You can make flashcards from those. I like this one. It's from 2015 or something. But it points out, this was on our exam, there's an OS opening. You've got these openings that were on the internal uterine open and the external uterine open, and one's for the vaginal area, one's for the cervical area. That was on our exam. But it gives you small bites of information that's relatable to those areas. Sorry about those pictures. But I like having small information. I don't want big information or paragraphs. More genitals. Lovely. But just, you don't have to. Knowing the ear parts and what they do for each ear. Like one of them's to carry sounds. One of them carries vibrations. One of them does this. One of them's the lube, you know. There's just a lot of little things that you can learn on your own. I like this one. And then they'll tell you just a little bit about the diseases and stuff. And you know, the ICD-10 book has all the anatomy in it that you need, and you can be in any year that you need. Before you have to code a section, they are going to give you, if I can get to one, I'm probably still on injuries and stuff. Where is our OB? So before you code diagnoses in sections, they have every body part listed. They can break things down to a cellular level, build up the organ, tell you its functions, what does each part do. Lesser vestibule, there was on my exam, that right there was on my exam. AAPC pulls straight from this ICD-10 book. The anatomy sections, their test questions, that one was mine. That gland was on mine. It's part of the female system. Then they list out all the diseases. If you're just familiar with these, you're going to be able to pass the exam. They have tons of anatomy in these books. It's just getting it to the places and knowing where to find it during the exam that's super helpful. They draw every part and tell you what the functions are. You just need to be able to learn this information, where your digestive system is, the order of digestion, what comes first, comes second. It's all here. If you're buying the books already, it's there. And then the common diseases, stuff that happens to it. That is the AAPC's 2022 version. I got it this way, and I have it in the PDF version also. And they have a new grant information where you can apply for a grant and get free books too, and they go over those grants monthly. I got their AAPC book, I got their CPT book, and their HipPix book this year, and the PSC thingy when it comes out. But so far only the ICD-10 came out and their CPT came out, which is way down there. I'm not going to pull it out. But yeah, I just get them from there because it's easy to order from their website. I've already got an account set up. They already have my info because I do it. I order the books yearly and then order my annual membership at the same time. Make sure my CEUs are all turned in, and I just do it all there one time. Probably overpaying, and probably could get it on Amazon somewhere easier, but I like getting the AAPC version because it's their book. They do add in some charts of their own into the guidelines that are supposed to help explain whatever's going on in this guideline. They do it throughout the book, but I don't know. They get way too complicated with some of them, but I do like this chart about coding which one first. Use, abuse, or dependence. You can only code one, and it's based off the hierarchy. So I like that one chart. It also comes with, well, maybe it's in the CPT book. I think it's maybe list of practical steps for using it. Preface. I think the practical steps for use talks about adding in information into your book if you want to, but in the CPT book, I like also getting the AMA version of it, but I do get it from AAPC. It just comes in a bundle from them. It comes with the instructions on how to use the book, how to code format. That's all super helpful. Is there, I don't know what I do with the page that says how to use it for your CPC exam. One of these books has it. I always forget which one. I don't see it tonight. Oh, probably in this one. I'm flipping around. My guidelines are so full of information. Right here, how to use this torture credentialing exam. And it's got that lovely sentence down here. Should you fail, you may take another exam for the same credential within 12 months at no cost. AAPC will let you know what section to work on before the exam. So that's for free, and it doesn't say anything about it being electronic or online. This is from the 2021 version of the book. I like that. It also says stuff about that you should add and highlight, that you should be sure don't glue stuff in there, but that you can mark, you can bubble, you can add notes and all that stuff in there. Just don't glue or tape anything in there. I like that they say that you could add the notes and all that stuff, because people get so worried about that. But don't. It's in there. It says to do that. So, love it. Taking your test in December. Yeah, it's hard not to be nervous. Optum's always usually got good stuff too. We used to get those free from Optum in the clinics. I've just not used those for the AAPC exam. I don't know if it makes much of a difference, but everybody's got their preferences, I think. But the main thing is your CPT book, and that's where 100 of your questions are going to come from. You need to make sure you have these boxed and annotated properly for sure. And all that other information I listed in the earlier live. So I will be not doing a live, I guess. Tomorrow's Halloween. Everybody's going to be so busy. So I will be back on Monday at 6:30. Arizona time zone. We don't fall back or move forward. We're just our own time zone. So that's just me. Arizona time zone, 6:30. We'll do another live. Be sure and send me your information, what you want to do on the live. You can either TikTok me a message, email me at codingbyjen@gmail.com. Join our messenger group. Find me on Messenger at Jen Brewer and join our group if you're 3 months away or sooner getting ready for your exam. Please join the group. You'll find so much information in there, and plus I quiz everybody daily in there, all for free. And I'll be making some more TikToks tomorrow because it's Halloween. That'll be fun. I'll be posting those, and tonight's live will be posted on YouTube, along with all my old lives that did record on TikTok are there too. So there's tons of free information on my website too. Nothing for sale up there. It's just unless you want one-on-one tutoring, which is $27. So copies of my pages of all my books, pages for the CPT book, and the notes for ICD-10 guidelines are on Etsy, and there's a link in my bio. I guess you can't click on it until after the live ends, but you click on my face here at Jim Brewer. It'll come up with a, let's see, it'll come up with a page that looks like that. If I can get back over there. There's my email if you want to email me, but you click on that link that says Etsy coupon, and it'll take you to the Etsy site, but it'll take 20% off of everything, whatever you want. So that's where that is. And those guidelines that have all the extra notes on it, even if you're going to keep your 2021 books, go on and get the 2022 notes. It'll have a little extra information in there, like the section for social determination, whether patients are homeless or not. That's the new codes they added in. You can ignore that, but most of the guidelines are all the same. But I've got a lot of information about coding examples, what they would look like, tips, more examples, problems that come up with coding this particular section. Plus, I still have all the original guidelines there. And it's listed, ooh, that's fast, with all the highlights you should do on all the guidelines throughout the entire guideline set. So it's a lot of information that would help you learn those guidelines for sure. Then you can go through and highlight them like normal, but then I've explained it and I've done screenshots of what it would look like inside the book as to what they're talking about here. So I find that's a real disconnect. They're talking about all this stuff, but then you don't know where that is in the book. I like to have an example of exactly what it looks like in the book. So, yeah, that's what's there. And I have some sequencing. Anything throughout the entire book, if it's colored up that color, that's the first thing you'll code in that section. It's repeated multiple times, but I do have a coloring guideline for the book as we're going through it. 1, 2, 3. But anyway, hopefully that's all helpful for you. And I will see you guys on Monday. Thanks for joining. We do have like $15 in our creator fund on TikTok. So I'm going to use that as just money to give away notes free to people that are in need of them. So when we get just a little bit more money, we'll be able to give away a section of the notes, maybe the guidelines or something, as I'm getting done with the new sections. My E&M for 2022 will be the next one I get done with. But I've got the guidelines done, and that's what we'll do with the Creator Fund money. So thanks, guys. I'll see y'all Monday. Let me know if what y'all want to cover on Monday, too. Hopefully cardiology was fun. We also did the consultations, when to code them and when not to code them. And we did E&M. I'm trying to remember so I can write it on the TikTok repeat live on YouTube. So we did consultations, we did cardiology, and I did a lot of jabbing and running around. We did some guidelines. Yeah, I did a lot of talking today without doing the process of elimination. So yeah, no worries. I'm happy to help, guys. I'll see y'all Monday night, okay? E&M, yep. Those E&Ms, mostly the consultations and E&Ms, yeah. Thanks, Leah. I'm going to go get some toothpaste from CVS this week. I know we've got a freebie. We got 2 tubes of toothpaste that are free this week. So, gotta run. Go get those. I'll talk to y'all later. Good night.